I have 9 kids. I got 7 girls and 2 boys at the end. That's when we finally figured out what to do. And I've had one daughter get married just this past few weeks, in the past month, and I have another daughter getting married in a couple weeks. So it's been a wild trip for my wife and I, and we hope the best for them, but I'm glad that kids are leaving the house. Now, if I can figure out how to keep them from moving back in the house, that wisdom would be appreciated.
Downsize.
That's what we come to decide, was to downsize, because our home, we live over at the top of the bench on the wide mountain in Provo, and the kids, they just keep finding their way back in. They take advantage. There's my wife over there hiding behind there. She's going to be reading her book tonight, and she'll let them back in, but we're a bit tired and we're ready for them to go. So we start another stage in life. And I have owned 47 clinics at my peak at one time. This was out in Texas. I'm not an original Utah individual. I moved out here about 7 years ago. But I definitely fit right in with all the kids, right? Fit right in. And it was a phenomenal experience, but there's lots of things. I'll talk about it tonight, about things that we did in pain management that's traditional, without getting the results that in the medical industry that we want, because it was just a revolving door of doing the same thing over and over again and not really helping people. So tonight we're going to be talking about the differences that we can do for our patients today. So we're going to be going over the revolution, advanced cellular therapy. And first of all, do start off, I do want y'all to congratulate yourselves for taking time out. So let's put our hands together for taking time for yourselves. A lot of people, and pats on the back too. A lot of people don't take time for themselves in life because we just start putting it out there for everybody else. But I want this to be of value to you, and I hope that it is tonight. We're going to be going over a lot of information. Some of it's going to get pretty sciencey, and hopefully it doesn't stay that way, and I'll keep you awake with going off the science, okay? So today's objectives, what you're going to be learning, the causes of your joint pain, degeneration, and also replacements. We're going to review available and current treatments, know the difference between pain versus symptoms. You're going to meet some of our patients in some testimonials that we recorded in our office, and of course, share food and fun and answer some questions that you have. What I do ask, we did give y'all a survey. Please fill out the survey so that we can better this process. And then also we have a sheet of paper and some pens. Write down all your questions, and then we'll answer those questions. If they're not answered during the presentation, usually they do get answered, but sometimes you have extra ones that weren't answered in the presentation. Just write those down as they come to you, and we'll talk about it after during dinner, if that's okay. We also do have a special offer for you tonight for the individuals that are coming here. When you set up your consultation and your exam in our office, understand that just by coming here, you are not our patient, and nor would you want to be. It's not till you come into our office for the consultation, one of our practitioners does the exam on you, and we decide if you're a candidate for what we do. Not everybody is, but there is a lot of people that we can actually help. Our purpose, honestly, in our clinic, what we try and do is to help as many people as possible in our clinics. You know, a lot of people have been repeating this process throughout their life. We go get medications and so on over and over again, and we don't get any real help. But we're going to talk about things that you actually can do. People have shoulder pain. My pointer doesn't work on a TV. Have you ever noticed that? Shoulder pain, elbow pain, hip pain, knee pain, foot pain, plantar fasciitis, arthritis, all those things and ailments that cause pain and inflammation in your life as we get older. An injury that happened 20 years ago in a car wreck, whatever it may be, all of a sudden it's coming to fruition now. We got treatment then, got rid of some of the pain, but it's just gotten worse as time has gone on because little things grow in your bones, discs start to shrink, whatever it may be, or knees. We'll talk a lot about knees tonight. Understand that we don't just do knees, but we will talk a lot about knees because it's most common. Now, what would you do? Now, here's the question before we start this, is what do you want your next 10 years to look like? And that's kind of what this video demonstrates on the sides of the screen. So one screen shows 10 years of life living a certain way, and 10 years of life living another way. But I do like to show this because I want you to start thinking a little bit differently. Because tonight you're going to hear things that are different. You're going to hear some things. You're going to see some things. And you're going to feel a different way. You know, we're in this nice warm restaurant. We're going to have a great meal after this. We're all here together, but I want honesty. That's what I want, okay? And that's what we try and offer to our patients, is we just give an honest truth. And you decide what is best for you. So this one's going to demonstrate what you want your next 10 years to look like. Can you hear in the back?
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide. The average Canadian will spend their last 10 years in sickness.
We don't need to worry about this part.
At Make Health Lab.
Okay, I just really like that video. So I want you to start thinking about, what do you really want your next 10 years to look like? And that's one of the things that we actually offer, a different outlook. Because a lot of our patients that come to us, they are patients that are at the point where it is time for surgery. Your doctor's saying words to you like bone on bone. Now this is a misused set of words that in the medical industry we tell a lot of people. But we say it to bring kind of reality into the picture. Understand, the reality is, if you're actually bone on bone, you're not moving at all. A true bone on bone patient, they are not moving. That's how serious bone on bone is. It is so bad and so painful that you are not moving. But most patients are at the point where they still can get around. Yes, there's a lot of pain, but not the excruciating pain that true bone on bone actually is. And I'm talking about whatever's left. There's something that we can do for y'all. You need to advance this forward. Here, hold on. Nadia. Okay, there we go. Okay. So here's a question for you. So what is the third leading cause of death in the USA? Any guesses?
Inactivity.
It definitely is a part of it. Definitely is. Well, here in the US, heart disease, as you know, is very widely known, is number 1. Cancer is number 2. Now, this is actually flip-flopping now. Believe it or not, I do want to say this disclaimer first. We have an amazing healthcare system. We really do. But we have some problems also. Anything, when you have such a large system, you're going to have problems in those systems no matter what it is. But we're actually going to discuss a little bit about that problem. The answer to number 3 is the healthcare system, unfortunately. And we're going to go over some things. Understand this. We ask everybody that comes out to this, do you think the U.S. is healthy? What's everybody's instant answer? Most people are saying no nowadays. Most people do say no. We make up 5% of the population in the entire world. But yeah, look at the second part. I think this is amazing in a bad way. So the U.S. spends more on health than about 95% of all countries combined. That is a crazy number. That math does not add up properly. That is because we only make up 5% of the population of the world, but yet we're using 95% of all the medications of all the other countries combined. That's crazy. What do we see during daytime TV? The commercials. They're all ads for some sort of pharmaceutical drug, right? And that's part of it, because that's not legal in most countries, believe it or not. We consume over 75% of the world's opioids medication. Do y'all know what those are? Yeah, your heavy painkillers. Yeah, so it's all your heavy painkillers that are highly addictive and destructive to the body. That's why in the medical field we ask you that scale 1 to 10. You know, what's your pain level with medication and your pain level without medication? those numbers actually do hold a lot of significance. One, we can't measure pain with any sort of little tool or anything. And sometimes imaging doesn't show pain, but that person's experiencing pain. And it doesn't show up on MRI or CAT scan or X-ray or whatever it may be, but they're experiencing pain. We ask you that because medications damage your body. We have to justify your pain level in a very special way that we're going like, okay, if you're a 4 with medication, that's acceptable. And then you're an 8 or a 9 without medication, we can justifiably treat you. When I say justify, meaning that we're going to cause damage to your body. It's just what happens with these drugs. It's just the side effect of it. But we're giving you some sort of quality of life by managing your pain. That's why in the industry we call it pain management. It's just managing. You used to live your life at a pain level of an 8 to a 10. Now you're learning to have to live your life at a 3 to a 6 on your best day. And that day that you did your level 6 best life, you're probably hurt for the next month. So that's why that pain scale is so important to us. Now, here's one that's unique from the GDP. This was a study that was done from 2000 to 2016. If you see at that top line, that's the US. The other lines below it, which is about half of us, half of the other countries, that's the rest of the world. So the USA spends almost double on healthcare compared to other top industrialized countries. It's mind-boggling. Again, remember that stat that we only make up about 5% of the world's population. But yeah, look at our usage. Mind-blowing stuff. Now here's a study that was done by Barbara Starfield. She actually got this into JAMA, which is the medical journal. The medical journal in the medical field is the Bible. Okay, it is extremely, extremely important. This is where studies are brought, studies are critiqued, and they're tested. And so what goes in there is gold. Okay, this is what they actually believe, not what's going on in the magazines or in articles. This is the stuff that's real. She brought out this fact about the healthcare system, and I'm surprised it was even let in. And this is back from 2000, and this number has gone up astronomically since. But I'm only given this because this is what was in the medical journal. Since then, there's been no other study put into the medical journal since this. So back in 2000, 106,000 side effects of properly prescribed drugs that led to death. So properly prescribed medications ended in death from properly prescribed. 80,000 died from hospital-caused infections. Everybody has heard stories or have a personal relationship with somebody that's gone in for some procedure, some surgery, and not come out. Some sort of infections set in and it wasn't taken care of, or they couldn't stop it from spreading. But again, remember, we still have the best medical system. I still want to say that. So understand that. For anybody that's been in the medical field, I do appreciate what we have here. We have some problems though. That's all I'm focusing on, so understand that. 12,000 unnecessary surgeries that led to death. Unnecessary surgeries that didn't even have to happen. 7,000 from medication errors. Whatever that error was, prescribed it to the wrong patient, that patient took it, died. Misdosing, whatever it was. 20,000 from other errors in the hospital. Look, when things are so big as they are, and how much we push our healthcare in this nation, you're going to have problems, and these are the side effects that are unfortunately very serious. So 225,000 deaths per year from medical treatment. That's what that number added to. That number is way higher again. This is 23 years ago now that this study was even put into the journal. So this is what we like to ask people: would you get on a plane? So that number, by the way, is if a Boeing 747 airplane crashes every other day, would you fly if that was the case? I mean, no, you definitely wouldn't. You're like, no, I wouldn't fly. If there was a Boeing 747 crashing every 2 days, you wouldn't fly. But yet that's our healthcare system currently that we're giving our trust to. And it's a sad stat. That's like 9/11 happening every 3 months. Yes, I have some scares in here, obviously, for y'all. Okay, movement prevents arthritis. You said earlier about people not being active enough. The best thing to prevent arthritis, get moving. In my neighborhood, we live in an older neighborhood, like I said, just up on the top of the bench. And most of my neighbors are 70 and up. And in fact, the mother of the University of Utah, the football coach, I won't say names in case anybody's like fans or not fans, his mother lives next door to us. And she's in her 90s. And up until really a month ago, she was out and about all the time. Even at 4 a.m., she'd come knock on our door at midnight all the time, asking for the funniest stuff. And we would just invite her in. She's just hilarious. But movement prevents arthritis, but this is what we say at our clinic. Proper movement prevents arthritis. So you're someone who has a knee injury, okay, or arthritis in your knee. You're moving around. Yeah, you're moving, but look how I'm moving. Is that going to cause other problems? I have more weight on this knee now. I'm moving my hips awkwardly. I'm bent over because of the pain. So I'm getting pain in other areas, which is also causing arthritis in itself. Okay? So understand that. So the typical treatment cycle, you feel some pain. You're prescribed some NSAIDs, some Tylenol, ibuprofen over the counter at first. The pain stays the same or it increases. Next thing you know, your doctor says, okay, let's send you out for some x-rays. And this isn't always in order, because a lot of times we're doing x-rays and stuff at first. Then he's going to give you some sort of like steroid injection to help get rid of the pain. Then you're going to be seeing that pain continues and worsen. Then you're going to be seeing for like get an MRI. Then you're at the point of surgery. This is the cycle in the health industry that we use. Again, this is what I did for over 15 years with all my clinics. And this was our program that we did. And it was sad because we really didn't help people. We helped them manage their lives to help get some sort of quality there, but it wasn't resulting in a pain-free life. And again, we're causing damage from medications, because now you see all these billboards on I-15 currently, and you'll see talk about opioid addictions, or people that have damages causing from it. I mean, there's thousands of people a year dying from those medications. So what are your pain medications really doing? The purpose is to alleviate pain at the nerve and brain and spinal cord level, lower inflammation at the site. What they don't do, address the cause of the tissue damage, heal or regenerate. We're just masking things. Basically just putting a Band-Aid on, not dealing with a real root problem. Getting to the root problem is how you solve real situations. We got to find the root cause of it. Yeah, this is a great one for dinner. I do like to show this. I'm fascinated by surgeries. Y'all may not be, but I am. But right here you have arthroscopy, and then you have a knee replacement, and then also a hip surgery going on right here. A lot of pain happening. You're asleep for these surgeries, but you have a lot of rehab that comes after, yes? The recovery ahead is long. Yes, your insurance is going to pay for a lot of it for those of you that are insured, so you're not having too much out of your pocket. Usually $3,000 to $15,000. I have a slide on that coming up. But then you also have the recovery, the loss of time at your job or in your company. Can your company actually continue to operate without your mind being present? Because it's a very powerful thing, and if we haven't built a company in a certain way, we can't be there to give them the better ideas to be more competitive with in their whatever industry it may be. Sometimes it results in infections. I think that one can get kind of gross, but at least I picked ones that aren't too bad. And maybe things don't turn out the way that you want. So as we just talked about, so that your typical average cost, again, we do it all right? But I'm understanding knees is quite common, so I talk about that the most. Typical knee surgery or replacement surgery, $25,000 to $50,000 end up, of course. Out of pocket with your co-insurance and so on, it's usually $3,000 to $15,000. Now, what are we talking about tonight? So we're going to compare some costs. So regenerative medicines or treatments, national average is between $2,000 and $6,500 per injection. Most of our cases are somewhere between the $5,000 and $8,500 range, most of our cases. Just depends on how many ailments, how many problems that we're treating. It really depends. And we also work that up to where you're not paying for each injection. And I'll tell you the reason why I can do that. So regenerative therapy with advanced cellular therapy. You've heard the stem cell name before, yes? Yeah, okay. So there's lots of ways that they are harvested out of the body. And stem cells are what actually created you, what created your children. Stem cells they're a cell that can create themselves. I mean, they create bones, they create skin, eyes, livers, hearts, everything. All nerves and so on. Now, some ways that stem cells are harvested. One way is through a process where we collect the bone marrow from typically your hip bone area, and we'll harvest that and then re-inject it back into the body, and it actually regenerates whatever joint is causing the problem. Another way that people do it out there is using mesenchymal stem cells. That's that outer layer, or Wharton's jelly is the outer layer of the umbilical cord that is harvested from healthy mothers. And the other one is adipose. Adipose is fat, that old fat from baby fat that's still with you. It's that deep layer that's there. And that's some of the ways that stem cells are harvested. And again, so if the clinic or the doctor is using things like amniotic tissue, there's a certain way that stuff is done, the legal way and the right way. These are harvested from healthy mothers, so the mother and father have to be checked out deeply, much like how mothers will go in, or a couple goes in and they're having trouble having a baby, and they check out the family history of the sperm that's being injected to the mother. Wharton's jelly, again, this is one of the areas that people harvest stem cells, and it's a very, very great process. It is, understand that all this stuff, when we talk about stem cells, it's been around actually for over 100 years. But this is something that drug companies can't get into. Why can't they get into it? Because it's from your own body. So they can't find their way in. And that in itself is the problem. That's why it's not as popular. Because drug companies can't get themselves into it. They can't make $1 billion product out of it because it comes from your bodies. Another way that we do it, and this is actually one of the most effective ways, is using PRP, platelet-rich plasma. Platelet-rich plasma is simply a blood draw. Okay, so we'll pull the blood, we spin it in a centrifuge, we collect the plasma, throw away the blood, and we'll get that rich plasma. There's actually multiple sections of it in there, and we'll re-inject that into the areas of wherever the problem is. If it's your shoulder, example, I'm a patient of all this right now. Okay, so I've had injections the past, Nadia, 5, 6 weeks, 7 weeks ago even. I always put myself last. Everybody was asking me, why did you wait so long? It's just what I do. Myself is on the shelf a lot. I'm pretty busy. And so my priorities are just lower on myself. And I had both shoulders, my low back, and both knees done. Knees, they already feel phenomenal, already. I had pain in my right knee especially every single day. That pain has actually subsided substantially. I'm not back in the gym because I was 375 pounds. I'm down to 270 right now, 275. And so losing the weight actually helped, but the pain was still there. Even if I keep losing weight, I still have damage to my joints. My shoulders, my right shoulder feels phenomenal. Left shoulder's not quite there yet because this process takes time. Because again, we're using these products to regrow what used to be in your joints. All the damages. We were talking about tailbones earlier. Was it you and I were talking, or was it you and I talking? Yeah, you and I were talking. And damages from all your active life. And I had a similar active life, it's a different way. I just wasn't using dirt bikes, but I was using skateboards and jumping off cliffs and all the stuff that I damaged when I was young. And I continued to have problems. And like even when I was a golf pro, still my back was a problem. And it affected me. I had to develop a golf swing that allowed me to play with a bad back. If any of y'all know Fred Couples, is very similar to his golf swing because he's definitely somebody who struggled with back pain in his career. Never made it to the PGA Tour. Just a little side note for you. Yeah, that all disappeared. We're going to use the computer now. Never made it to the PGA Tour, but I tried for about 3 years, and it was absurdly expensive to try and get there. And eventually, I had an ultimatum. I had to choose what I was going to do. Thank you for getting that. Well, you got your glasses on.
Yeah,
I'd appreciate it.
we can do that.
Yeah, thank you. Anyway, so I had these injections done, just a little over about a month and a half ago. Like I said, the left shoulder still has some more growing to do, but the other ones I had a quick response. Now, thank you, sir. Not everybody gets that response, but I sure did. And we had lots of patients that come into the clinic and do get a fast response. But for most people, we say 3 to 6 months it takes. And you have to just be prepared. This is a different process than what you are used to. Because you're used to going into the hospital, getting things done, then you just expect a long recovery period. Whereas in this case, this is a non-surgical option, and you're not going to the hospital. It's an in and out patient process. You're just coming in and you're leaving a couple hours later. That's literally how it is, and we're just doing the injections. It's non-invasive. Even the bone marrow is actually not as invasive as you would think. So PRP, fantastic product, definitely one of our actual tops that we love. Now remember how I said that this has been around for over 100 years? So Maximilian Stern, MD, he was grafting in using, I'll just kind of, in layman's terms, he basically took a placenta and an umbilical cord, put it on someone's burn, and then it started to regrow faster than normal. Phenomenal thing that happened. And over 100 years ago, we knew about the strength of stem cells, what they can actually do. But again, you're finding some pretty big giants out there that aren't going to release their hold on the market with the big pharma. So a lot of people haven't realized that we've known about this for some time. Now the past 10 years though, we've gained a lot of ground in this industry. And our patients are coming out happier than ever. And it's just amazing the results that we get. So like I said, about an hour procedure of the actual procedure, but we do have processing time. So if we're using like someone's bone marrow, you'll come in the morning, we'll take the specimen and then we'll process it, and you'll come back after lunch. Then we'll actually do the injections after lunch. So that process is longer, so you would have to be in our area at least for about 4 or 5 hours. Whereas if we're using other products, they're usually pretty quick, 45 minutes, hour and a half of the actual process of the procedure. Really zero recovery time. We're not using anesthesia for most people. If you need to be put to sleep, you can be, that's okay. For bone marrow people, I kind of recommend it. And if you think that you're gonna pass out, most men, we all tend to pass out. The women tend not to. Even with blood draws, most men pass out. And I thought I was pretty tough, and when they were doing my knees, I forgot to breathe for a while, and I'm watching it because I'm always just fascinated by everything. And next thing you know, I look up and Nadia, I'm like, Nadia, I'm sweating like crazy. She's like, Phil, you look like you're about to pass out. And so she has me lie down. And it was just, I was like, oh, I didn't think I'd be that person, but I'm definitely part of the stats when it comes to men passing out. Clinically, so expect significant improvement really in 1 to 3 months. Because we want to know when you're having an improvement, we want you to call us and tell us what's going on. How are you, like, what would you say, 25% better, 50% better, whatever that number may be. So minimal adverse side effects. Some people may have a little bit of fever, swelling, and ache at the injection site. We actually want this to be a process that's inflammatory. So you actually will feel an inflammatory process. Well, you'll have some aching going on. That's actually a good thing. That's part of the process. And we don't want to stop that process. So no ibuprofen will be taken during this time. You can take Tylenol for some pain relief, and heat only, no cold. But you'll get all this information. And we'll prep you so that you know exactly. Now for knee people, you will get braces that you'll wear for about 6 weeks or so to help alleviate some of that weight that are load bearing. So you're gonna get to meet some of our patients here that have been in our office. I just left a couple on here, I believe. So this is Lila. She's 84-year-old female with debilitating bilateral knee and low back pain. She was a very active traveler when she was young. She has pain walking upstairs and couldn't walk for long periods of time, making it difficult to enjoy life. She was recommended knee surgery patient. Let's see if we can hear her.
I wanted to talk about my procedure that I had. Injections.
Yeah, right.
Injections were not the best part, I will tell you. But my knees have been super since I had it. I'm very grateful that I have it.
Yeah, just a simple testimonial. I want the truth from people. I want them to tell us when it's wrong or right. You know, our commitment to our patients is that we figure it out. So whenever a lot of people, you'll go into these clinics and you'll pay them a fee, and then, hey, it's not working. Then 3 months later, you'll pay them another fee, and then you pay them another fee. It's a whole business model. In our case, what we do what it takes to get it right. And what we charge you in the beginning is the only part that you're actually going to have out of pocket. Okay? That's our commitment to our patients. So like I said, we operate differently. It's not the best business model, I'll say that, especially for somebody who's owned a lot of them, because I never used to do that. Okay. So this is a physical therapist, 54-year-old female, debilitating, again, bilateral knee pain. She had numerous dislocations in her knees in her 20s, so very young. Recommended arthroscopic surgery at age 22, told she would need knee replacement in her 40s and 50s. I don't have a video of this patient here for HIPAA reasons, that she didn't want to reveal her name. She's a very popular person, does a lot of ads. Anyway, so first day of the injection was day 1, and then a week after, she talked about having mild inflammation in her knees. 4 weeks after, she was able to wear heels for a 2-day conference for the first time in forever. Able to do a full squat to get a case of water. This was her own story. So the way that she described it, she's at the grocery store shopping with her mother. She went down to put like a 24-pack of case of water down at the bottom of the cart. She squatted down, and she went all the way down. Then she looks up at her mother. They have a non-communication moment, and they're like, look at what just happened, realizing that she just did a squat for the first time, and who knows how long for her. And she was super excited. After 12 weeks, this patient, again, this is a very active person that does physical therapy with patients. She described it as 95% better. Started running pain-free and squatting. And then she said this, and I thought this was significant. It is strange not having anything bother my knees. What an odd feeling, because we live with these chronic pain feelings in our body for so long, and it just doesn't make sense that you actually can have a solution to that now with regenerative therapy, because you're going to regrow those parts of the body that have all this degeneration happening. So what we're going to do, we'll look at some x-rays of some patients. I think this is the patient that was like 93 years old, or it might be the next one, I can't remember. So February 20th, and then a year later we took new x-rays. You can see on the left, now what I want you, my pointer doesn't go up, but what I want you to, if you follow my pointer, you compare the outside knee to the outside knee, okay? So that's going to be the right knee, the right knee here, left knee here, left knee here. But I want you to compare the outside of the knee to the other outside of the knee, and the inside to the inside. That way you can see the difference. On the left, you can see hardly any spacing, right, in that joint? Hardly any spacing. The meniscus is just about gone on both knees. Then a year later, using this therapy where we regenerate using things like PRP or stem cells, whatever the process was, you can see how on the right side, look at the change in the left knee, how it is just not touching anymore. Look at the change in the right knee, which is awful. That was definitely a lot of pain happening. Phenomenal change there. You look at this next x-ray. Yeah, that was the 93-year-old patient. Nobody would operate on her, obviously, by the way. Nobody would touch her. And she was not a candidate she was a candidate by looks of it for knee surgery, but due to her age, she could not do it. This is a heavier set female here, February 27, 2020. Look at that right knee, how on the left side, look at that right knee, how bowed in it is. and you see how the bone even kind of lips up like a wave because of that pressure of that knee being so knocked in like that. You've seen people walk like that, and there's just no spacing there. Then you look at May 20th, so just a couple months later, May 20th, look at that right knee. Multiple things. One, you see that spacing in the meniscus up there? Again, we're looking at this one. I know my pointer's not over there, but it's that one over there. You see spacing all the way across. That meniscus is now regrown. And look at the angle. The angle is not as severe anymore that quickly. Not everybody is this way. Your healing depends on your health. Diabetics, you know you heal slow. Expect a longer process for this, really up to a year. Most patients at 6 months, we're reevaluating, seeing where you're at. If we're not satisfied with how much you've changed, your pain levels, and again, not just symptom of the pain, but the actual x-ray, when we want to look at it, 6 to 9 months, that's the time we're actually going to pull you back into the office and recheck. See how we're really doing with imaging that will show the change. Because sometimes the pain is also up here because you've been used to it for so long, yes? So anyway, so again, so our offer to you, understand, our offer to you, so normally when people come in off the street in our office, yeah, I don't. When people come into our office, we have them come in and for consultation, x-ray, and exam, that's a $250 visit. Really, it's $249. So that's normally what it is. And then for those of you that book with us today, the girls will come around, set up appointments. For those of you that book today, you get $49 for that visit. And that includes the consultation, exam, and also the x-rays, because we want to see. And if you have some history, surgeries, bring as much as you can. We want to know, to help the doctor come to the best possible treatment plan. If you're a candidate for this, bring everything. We want to know your medications that you're being prescribed, that you're taking. We want to know what supplements you're taking, because some of those supplements can affect like certain things that thin out your blood. We want to know what supplements you're taking, so bring that information. If you have old imaging, you go ahead and bring it. We are going to retake new x-rays. We want to see that joint. And the x-rays are really all that we need. We don't really need MRIs. But if you have it, bring it with you. And again, for those of you that book today, over the next few days, we already have cleared out on our spots. We have 11 spots available. So 11 spots available for tomorrow, Thursday, and Friday, and you get that $49 price. After those dates, then it's going to be our regular price of $249. And you'll come in, you'll sit down, we'll do all the normal procedures that you do when you come in, and take some imaging, and then you'll have an exam with the doctor, and you'll most likely be sitting with me, and we'll talk about where you're actually at. Once I know the treatment plan of the doctor, then you'll know, and you'll be able to decide if this is for you or if it's not. But I do understand that pain doesn't go away. It just gets worse. Degeneration just continues to get worse, y'all. You'll see in our office, I'll show you some bones that show degeneration in the spine and in the knees, and you'll see how they just get worse over time. They don't get better. This is the only way currently that you actually can regenerate your joints to become hopefully pain-free. Now, we say about 50 to 80% of everybody gets to experience this, and they get to experience about 50 to 80% to be better. That's a big change. That's some serious numbers. That's phenomenal. But not everybody's a candidate for this. So anyway, so when the girls go around, just go ahead and give them your information, and they'll set up the appointments. Again, we have 11 that are available right now, and we'll get y'all set up. Thank you for your time tonight, and appreciate y'all listening in. Thank you. Yeah. Yes, sir. Over in West Valley, Bangor and 35th. We're an integrated clinic, and so we have multiple things that we do there. So we do chiropractic and massage, pain management, and also regenerative therapy currently. Yeah, if you want to pay more, go to the east side. West side we can save though.
How long, like that treatment, how long does it last?
So you're regenerating. So this is like, we're trying to get your joints to as new as possible. So unless you have new damage, then that's different.
Like that 49-year-old physical therapist, would she ever do that again, or?
No. Most people, one treatment's all it takes. Sometimes we got to do a couple treatments to get it to work, rechange our formula. But it's because you're regenerating a whole new system. It's not like you're just buying time. But again, like I say, how do you want your outlook to look like? And you decide that. Understand, in life, you can only have 2 knee replacements. We hope that everybody gets a knee that lasts them 20 years. They are doing knee replacements on 20-year-olds now. It's insane what's happening. But you can only have 2 knee replacements. A 20-year-old that gets a knee replacement at 40, say it lasted 20 years, 40 they get another one. What are they doing at the 60? It's amputation time. A knee goes in, you have an infection, knee comes out, that's 2 knee replacements right there. You're now at amputation. This is a way to avoid surgery. That's all this really is. This is a way to avoid surgery. Some candidates, we're going to say, yep, we do agree. You are at that point. We cannot help because it's the degeneration's too much. You're about fused. How are you even moving right now? Go to the hospital. Go get your time. But most people, we can actually help. I kind of describe it to people like this. Actually, it was described to me like this. He's like, Phil, put some toothpaste on your knuckles in a line. I said, okay. I actually did this. I put toothpaste on my knuckles. And he's like, put your fists together to where your knuckles fit in those pockets there. I said, okay. And then he said, Phil, is there toothpaste still in there? I said, doesn't look like it, but yes, there still is toothpaste between my skin. That's enough for us to do the procedure, to regrow it. So like a meniscus, that's like you saw in those x-rays, there's down what looked like nothing. What looks like doesn't mean there really is nothing. Again, bone on bone, it's a misused thing in the medical world. And we just say that so people understand you're in a serious point. You need to make a decision. But now with regenerative therapy, you can actually possibly avoid surgery, avoid all the downtime that comes with it. And it's actually less cost in the end. That's the thing about it, even with insurance. Because you can't just include the surgery, you got to include your time that you're losing. And if you're still working, what are you missing out at work? What's your business doing? How's it failing? Is it winning without you? So some things to think about. I'm here to answer any questions. I'm going to step out real quick. Yes, sir.
Does insurance cover any of this therapy, or is this all?
Some insurances cover PRP, but military veterans. So military insurance will cover PRP. Insurances are not covering stem. Anything with stem cells. So typically, like BMAC is typically what we'll use. BMAC is the bone marrow one. And that's all out of pocket. It's just not supported. And you're not going to get support from insurance companies because they're not going to support really what is not supported by the pharmaceutical industry. They're all integrated together and they grow together. And so you have out-of-pocket things. But this is a real solution and it works.
How about PBR? Is that covered? PBR?
Professional bull riders? No, it's not covered. I can't remember the name of the insurance company for military, but TRICARE. TRICARE is the only one that even covers PRP. And there's thousands upon thousands of studies. You're really at the point of just deciding you don't know until you just go. So $49 is the problem for you, then don't come. If you're here just for the food, I know people are here for food. If it's just for food, don't waste yours or our time either. So anyway, yes ma'am.
Some say that my recovery took 9 months. What do you think approximately the final cost would be?
Well, most patients are between that really $5,000 to $8,000 range of ours. Yeah, that's usually what it is, even if we're doing multiple areas. The reason why I don't charge per injection is because I'm going to collect enough like bone marrow that's going to have stem cells in it from you that I can shoot multiple areas. And so since I'm already in there, it's no time out of our cost to do that. So we're just like, okay, you have back problems too. We noticed that on the x-rays. Let's take care of that. Let's take care of your shoulders. So there's multiple things that we can do. And that's the way that we keep costs down. We keep costs down because we're in West Valley. West Valley is less expensive. You go to the east side, you're going to pay 50% more. Yes?
What's the risk of
So PRP,
Side effects of that?
no, because PRP is the simple one. It's just a blood draw. You know, we're pulling out 60 cc's mostly. So that's just about this much of a little vial about that thick. It's not too much. And we just spin it and we get the plasma, and that's how we get the PRP, the platelet-rich plasma, because there's a certain section of it that's the rich stuff that we want. The other stuff is useless. Yes, sir.
So if you have the PRP, the stem cells, and the bone marrow, are they one of them? I mean, what's their effective? Which one's the most effective? Which one is
So-
not? Are they all the same?
So like, we'll just, again, I'm going to talk about what we mostly do with the BMAC. So with bone marrow. So with bone marrow, that's actually a collection of stem cells,
Okay.
okay, that are originally from when you were a kid, and those stem cells that were on the part of the umbilical cord that's inside of you still went to different places. They deposit themselves, I didn't explain that very well, they deposit themselves into your fat, into that old adipose fat, and they deposit themselves in the bone marrow. Whenever you have a cut, that's your body using stem cells to heal itself. Because remember, stem cells can recreate anything in our bodies, even recreate in, other stem cells. PRP is different. What PRP does, it's like a megaphone. It says, it calls the bus that's full of stem cells, says, bus, come over here. And then the bus drops off the stem cells, and then the stem cells drop off what's called exosomes, and that's what actually heals you. So we use PRP in all cases. We try and start with PRP first before we go to stem cells, but we start there first most often. Not in all cases, just depends on you and your health. Someone that's unhealthy, we're going to want to grab stem cells because PRP most likely won't work. But we use them all together to hit as many areas as possible to get those stem cells to do their job.
So if you did PRP, stem cells, the bone marrow, or the fat, or
Yeah.
whatever, you're saying you do all of them in a package when you're paying the thingy, or is the PRP cheaper than the stem cells, and the stem cells are
Yeah, PRP is a less expensive process.
maybe not as effective as the stem cells?
Yeah, not always. It just depends. PRP is the one that's most recognized and most supported. You kind of follow the market with stuff, but it's about what really is going to work. That's all that I really care about. As long as it's really going to work for the patient, that's all that matters. And not everybody we recommend stem cells for, but typically those are going to be individuals that are in great health. They have severe problems in their joints, but they're not diabetic, they've maintained health in their life, and they show no other problems. So that candidate would just most likely just be PRP, not stem cell. Just really depends on what the exam reveals and what the doctor comes up for the treatment plan. Did that answer it mostly? Okay. Any other questions? Okay. All right. If y'all get to the food, should be out pretty shortly. You already gave them the notification to get it to us, yes. Okay, great. Thank you.